backstage, you just don't know it. Also, who buttoned this? Who did that for me? Well, good morning. How are you? I'm Dr. Gaslighter. Welcome to our clinic. How can I help you today?
Well, I'm kind of embarrassed to say, but I'm just not feeling like myself. And I have eaten the right things, I have exercised, nothing has changed. But I keep gaining weight right here. And I just hear all these people talking about how they went to their doctor and anyway, I just gained weight right here. Can you help me with that?
Yes. So you're gaining weight.
Yeah,
Okay. And you're not feeling like yourself.
right.
Okay. So I have pills for that, and I can recommend you to a metabolic specialist.
Okay.
Okay. What else?
Well, some days I just can't get off the couch. I'm just so sad, and I don't know why. I'm not normally a sad person, and I just spend my days just watching TV and crying for no reason.
Okay, so weight gain and you're depressed. Okay, I have a pill for that,
Okay.
and I'll refer you to a psychologist.
Oh, great. So can I bring up one more thing that's really bothering me?
Sure. Yes.
So I can't sleep anymore. I will go to bed at night and I just cannot fall asleep. And if I do manage to get to sleep, I wake up at 3 a.m. every single night.
We'll send you to a sleep specialist for a sleep study, and I'll give you a pill for that.
All right.
Okay?
Okay.
You good? Yes, ma'am. Sure.
Okay.
Yeah.
So my
Here for you.
shoulder really hurts, and I didn't do anything to it. I didn't pick up anything wrong. I didn't turn it the wrong way. I
Because
wasn't
you're on the couch too long?
Yeah.
Okay, I'll send you to the orthopedic surgeon, and I have a pill for that.
Okay, what about when I get hot at night? Is there something you can help me with
Is your
for that?
air conditioner broken?
All right. Well,
Oh, your thyroid. It's your thyroid. It's your thyroid. I'll send you to an endocrinologist, and I have a pill for that. Anything else?
okay. So I'm married. I've been married for a very long time. We have a great relationship, but intimacy is just not something I'm interested in anymore.
We're going to have to save that for another time. Sex is a luxury. And I can give your husband a pill for that.
Oh yes. Okay, I've heard of Viagra, right?
Yes, wonderful.
But what about me? Because
Oh, he'll be just fine.
but it hurts when we have sex.
Lubricant's wonderful. Lubricant's wonderful. Yeah. Grin and bear it. Okay, I have a pill for that.
And a glass of wine, right? I've been told that wine helps.
That's a great libido. I think something about oysters being an aphrodisiac, quail eggs, things like that. Those might help. But I'll send you to someone. So referral to psychiatrist, and we'll consider a pill for that.
Okay.
Okay, great.
So-
So I'll see you in 6 months, and you can be out front.
Okay.
Have a great day.
Thanks
so
for
good to see
nothing.
you.
All right, does that resonate with any one of you out there? Yeah, yes. I mean, it's just like, I think the reason that women are gaslit is because maybe the physician or the provider does not know what to tell you, and they're afraid that they don't know what to tell you, so they gaslight you so you'll stop talking. And that works, right? So.
These are very out-of-body experiences for us. We sit here and we listen to patients, and we don't have any training for that. We haven't for many years, decades actually at this point. So, excuse me, ladies. I'm sure I look better with that. But, so at this point, when we have patients sitting there and really having all of these symptoms that they're talking about, we shut down. I'll tell you, it's even worse than shut down. So in surgical training, this is legit, you guys. This is so terrible in my opinion. In surgical training, I remember being a trainee and being told by my attending surgeons, so the people who were my mentors, who were teaching me how to have a career in surgery, how to take care of patients. I remember they're letting us know that as you're seeing a new consult and you're going through their list of diagnoses, if you see something like fibromyalgia, immediately you're to think that woman's crazy and limit the time that you talk to them. I wish I were kidding you. So this is what I was instilled to think and to believe about women's health care. So never heard the word perimenopause, never heard the word menopause. It was like the change, hearing that from other patients, but never hearing it formally in our training. And my amazing third-year medical student, Brittany, can attest to that. She's actively in medical school, and they've never talked about it. So if you know anybody who's in OB gynecology, the typical thing is they maybe had a volunteer luncheon where they got pizza and an hour-long discussion about perimenopause and menopause. This is actual. This is across the board for decades.
Yep.
So no wonder you're coming to us and we're ill-equipped.
The current statistic is 31% of medical students coming out of training that are prepared to take care of menopausal women. So 3 out of 10, if you get lucky, and that's a short lecture. So anyway, Mandy, why are you taking care of women? I thought you were a surgeon.
Yeah, so funny story. So yes, I've been a trauma and general surgeon, but as you can see, I have lots of gray hairs. So as I was in private practice, actually I'm a second career surgeon. So I was a nurse practitioner. I was an ICU nurse first. And so I'm a good 10 years older than the people that I was in training with. And so when I was going through, actually I think I was 36 when I graduated medical school and was going into trauma training, into surgical training. So I became perimenopausal very quickly. Didn't know what that was. I just remember running my team up the stairs while we were on rounds, and I got to the top and I was dizzy. I'm like, what the heck is that? That was the first thing I knew about perimenopause. I mean, I didn't know what it was. I just knew I had dizziness. So going through, my residency, the end of it, being a chief resident and then a trauma fellow, I was having all these symptoms, had no idea what they were. I went to see an OB gynecologist up there. Yeah, absolutely. Go to see a gynecologist, and she was like, well, you're not in, she got labs. Any of you who've been here, you have symptoms, you go to your doctor, they get labs. What did I get told?
Normal. Your
labs are normal, you're not in perimenopause, what? So I just trucked on through, and then fast forward to when I was in my first practice, employed practice, I had more symptoms. Periods were starting to be crazy, and so I asked my OB gynecologist at the time, what's going on? Again, check my labs, and so at this point I was like, I must be crazy because this is nuts. And I was told I could get put on black cohosh, which is a great supplement that can help. So then it started becoming more difficult because I'm a surgeon, so I could be scrubbed in for a case and have all of my garb on me, be under these bright lights, and have a hot flash where immediately I'm on fire. I can't do anything about it, y'all. I got someone's life in my hands. I got a knife in my hands most of the time. So I just had to grin and bear it and suffer. So finally last year I realized, wow, this is what's happening, and so started walking forward into my own health journey of figuring out what it was. And then God plopped an angel from the sky. She looked like a beautiful little cherub. Oh, I'm sorry, it was Mandy. And so she opened my eyes into the world truly of hormones and what's happening to our ovaries. So if you guys don't realize this, I didn't, we are outliving our ovaries, right? So life expectancy, if you look it up, I did this recently, 1900, life expectancy was 48 years old. Guess how old I am? I would be dead. I'm I'm 48 years old. I'd be it. That'd be the end of the road for me. That was just in 1900, y'all. Not too long ago, we knew people that were born in 1900, right? So we didn't even come up to being in the 60s, staying alive until to the 60s, somewhere around the 30s, 50s. It was very recent, past couple of decades, where now we hit 80. It's like 81 or whatever, so we've been vacillating around there. So this is a new thing for us to outlive our ovaries. Well, what's happening if we outlive our ovaries and we're not replacing the work that the ovaries were doing, making the progesterone, the estrogen, the testosterone, a whole host of chronic diseases. Oh, what are they? Osteoporotic fractures, right? Osteoporosis, chronic diseases like diabetes, obesity, problems like heart disease. What's the number one killer for us? Heart disease. Genitourinary syndrome of menopause. Mandy, what are the 3 things that are going to put our butts in the nursing home?
Yeah, so that would be incontinence. That would be
You're peeing on yourself, y'all.
A hip fracture and dementia. Those 3 things. Guess what can help prevent those 3 things? Estrogen.
In fact, everything that my precious little patient that was getting gaslit had complaints of would all be fixed by getting her hormones just physiologic, not pregnancy levels, not birth control, synthetic birth control levels, just physiologic.
Yeah, so can we talk about the definitions
What are hormones?
of hormones, and then what about perimenopause? So that is the years leading up to your final menstrual period. And so that is usually around age 35. I see a lot of young people in here. So you need to know what is coming, right? And not to be afraid of it, but just so that you can get help and that you can ask questions. So average age of final menstrual period is 45 to 55. Okay, average age in the United States is 51. And so menopause is 1 day. You get 1 day of menopause every day. After that, you're postmenopausal.
Forever.
And so,
sorry, jaded.
and that right there, those group of women is what brought me to where I am today. So as a women's health nurse for 20-something years, went to nurse practitioner school, got hired on at Baptist at urogynecology, and all of these women over the age of 50 were peeing on themselves. And they would look at me and say, I can't leave my house. I'm just peeing on myself all day. I can't even go to Walmart because my pants will be wet, and that's embarrassing. And they were spending all of their money on diapers and pads. Those things are expensive. And then they would get up the courage to ask me, well, can you help me get my insurance to cover pads? I'm thinking, how do we prevent this? I don't see 20-year-olds, 30-year-olds running around peeing on themselves. It's all 50 and over. What is the answer? There's got to be an answer. And it's vaginal estrogen. So I learned about vaginal estrogen. And by the way, vaginal estrogen is safe for 99.9% of women. You can even have vaginal estrogen while you are undergoing breast cancer treatments. It's safe, okay?
Even your grandma can get started on it.
I have 99-year-old women on vaginal estrogen. No longer getting recurrent urinary tract infections. So if vaginal estrogen is the answer for a 70-year-old and 80-year-old, what about a 40-year-old that's starting to have hot flashes or mood changes or joint aches and pains? So that led me down the whole rabbit hole of hormone therapy, and people were not talking about it. Doctors weren't talking about it. Nurse practitioners weren't talking about it to their patients. So I got into the world of podcasting, and I have many resources for you. If you come up to me after, I can give you a few names if you're interested in just learning for yourself. But, I started the Tips on Tuesday. I don't know if any of you guys are following that, but I'm about 3 years in, and the feedback that I get is women are hungry for this information. And so I started down this whole rabbit hole of how do I get certified? How do I learn? So I became menopause certified, as Mandy is, and as far as I know, we're the only 2 in Hot Springs, and there's about 20 in the state. And so what that means is we took the initiative to learn more about this topic. We took a test. It was not the easiest test that I've ever taken. And we gained the status of certified menopause practitioner. And so that we love talking about this subject. We study, we talk to women every day about their hormones, and it's not a taboo subject anymore. Okay, so I want you guys to have these conversations with your sisters, your friends, your mother, your daughters, because it just should be talked about. There's no more pigeonholing women into a corner and be like, this is just aging, this is what you have to look forward to. That is not an acceptable answer. If you've been told that, seek somebody else out.
That's the thing, is we're at this stage now where we've I've gone through the stages of grief. I was so angry at first. Why didn't I know about this? I'm accepting and all that. So there's such a vast knowledge gap for all the practitioners and for all the patients out there that, number one, we're trying to expose the problem. There's a huge knowledge gap. How is there a huge knowledge gap? And educate, like Mandy's saying, like all the education pieces that we do. And I'm slow rolling. She's my mentor. So now, my husband and I just opened Direct Integrative Health. I'm menopause certified now, and we're starting to treat women too. It's going to take more than just us practitioners for Hot Springs area. But we're starting somewhere, we're starting big, and a huge plug for both of us is that we're all about educating. That's the dignified approach. Is it dignified for anybody in this room to regularly pee on themselves? Ladies, we are the fastidious ones, right? We want to dress up, we want to go see our friends. How undignified is it to be around the significant other that we may have, or around our girlfriends, and have to wear Depends? This is why my heart turned so hardcore for our women and for midlife health, because I have ladies coming to me for gallbladder surgeries, hernia surgeries, any kind of skin disorders, and these things are all wrapped around not having their estrogens and their hormones at the physiologic level. And I didn't realize people with thyroid problems, people with autoimmune problems, it's always, I just was talking to a girl this morning, she's on methotrexate. That is a terrible drug to help her with her autoimmune disorder. Guess what? She lost her ovary function several years ago, had no estrogen exposure, and then what did she develop? The autoimmune problems. It is a pro-inflammatory state to not have our estrogen, progesterone, and testosterone. So what is happening with our body if we're smoking, if we're drinking alcohol, and if we don't have hormones? That is a pro-inflammatory state, sets us up for a myriad of cancers and a myriad of chronic diseases. So we're here to expose the problem, educate everybody. You guys are all intelligent women. The more women we reach with this education, with this knowledge, the more we can all become advocates for ourselves and go to our practitioners, go to our doctors and say, I know what I need, please help me get there. And we can talk about that. If you guys were here last year for our talk, we had that handout about how can I speak to my physician, to my practitioner about what I need, and this is another layer of that. It's the most important layer we've ever had. This is how our girls are dying, and it's the largest healthcare crisis in the United States. The healthcare disparity is that we have not gotten research, we have not gotten healthcare, and people just want to close our minds up that there's a whole group of us that are outliving our ovaries and that are dying as a result of the chronic diseases that come up from it.
So 1993 was when women were first entered into studies. We weren't even studied until then. That's not that long ago, right? Women are not little men. We do not behave the same way biologically.
Thank the Lord. Oh, sorry.
Yeah. So it's very important to not only understand that hormones can fix problems that you're having currently, but they can also prevent diseases. I had a patient, she was 52, come to me this past week. Her last menstrual period was 2 years prior. She was having no issues, no pain, no hot flashes. She was sleeping fine. And I said, how can I help you? She said, I went to dinner with 10 of my friends and all of them are on hormones except for me. Do I need hormones? Well, yes, that's my answer. Blanket, yes, because of the prevention. You don't know. You cannot tell when your arteries are hardening. You cannot tell when your bones are becoming brittle. You can't feel those things. They just happen. And so, estrogen is FDA approved for 4 things, but we know that they help so much more than just the 4 things, which are hot flashes, night sweats. Night sweats are just hot flashes at night, so it's the same thing. Genital urinary syndrome of menopause, which is what happens to the things in the pelvis years and years and years after you lose the ability to make estrogen. And then prevention of osteoporosis. So my patient that was 52, I would have ordered a DEXA scan, but she had just gotten it. Guess what? She has osteoporosis. No other symptom but osteoporosis. So we started her on estrogen. And by the way, you can actually reverse osteoporosis. It takes some work on your part. Even if you are not a candidate for estrogen, which is a very small percentage of the population, you can reverse osteoporosis. It's been studied.
And if there's anybody in the room that's like, well, I have osteoporosis, but I'm on alendronate or the bisphosphonates to help, that's like putting a harmful Band-Aid on a wound, right? The base of the problem is a lack of estrogens. So giving something that's external, that's synthetic, that's got a lot of side effects, that's only going to try to fix the problem surface level, right? But the root of the problem is a lack of the estrogen and progesterone. So estrogen being, it stops the breakdown of the bone. Progesterone, it builds up the new bone, and even testosterone contributes to that strengthening as well. So the root of the problem is not getting fixed, even though you're getting these very expensive shots every, week or month, or you're taking all those pills for it. The root of the problem is a lack of the estrogens and the sex hormones.
So speaking of osteoporosis, I'm going to call Sarah out over here. Sarah is 40, what?
Almost 47.
47. She's a patient of mine, and she told me I could tell you this. It's not HIPAA. Yeah. So we had a conversation yesterday because in my clinic it's going to be very important to not only replace the hormones, but we talk about nutrition and fitness and how to lift weights. And I have an in-body scanner that tells you the breakdown of your muscle to fat to bones to how hydrated you are. And so she said, I don't want to work out. I'm not working out. I hate working out. I said, okay, well, what about your 80-year-old self? Think about when you're 80. What do you want to be able to do when you're 80? You want to be at home with your grandchildren. You want to be able to get on the floor with your grandchildren. You want to be able to carry your groceries inside. You don't want help. Women don't need help. They definitely don't want it at age 80, And so to get to that point, you don't know what your bones are doing. And you need bone strength and you need muscle strength. If you don't have the muscle strength, you're not going to be able to do those things. So the statistic is after age 30, you lose like 8% of your muscle every decade. That's a lot of muscle. So if you're not actively trying to maintain or replace it, it's going to go away. Whether you're doing if you're not doing anything, if you're just sedentary, there's sedentary death syndrome now. That's actually a thing. Being sedentary is the new smoking. That's why, because your bones and your muscles, they just deteriorate. It's called sarcopenia. So, my friend.
Yeah, so here's the thing. We're not your mom, you're grown-ass women, right? We're here to tell you that, no, you don't have to do this. You don't have to take hormones, you don't have to do the lifestyle. If you want to be around healthfully in the next 10, 20, 30 years, these are non-negotiables. Otherwise, it won't be with your health span. It'll be you'll be alive, in and out of the hospital, going to the nursing home, falling, breaking your hip, all these things. The statistics are terrible. Fracture from osteoporosis lands you in the nursing home, as we discussed, and also risk of death in the next 12 months can be as high as 30 to 50%. Okay? Because of all the sequelae that means if you are so-and-so years old with osteoporosis, all the things that it means from your body. So the comorbidities is what we say. So it is up to you, and that's why we're coming to you, because we are women, right? We are the sisterhood. We help each other. So both of us are working together in our community. We're actually going to start focus groups this month, bringing together all of the parts that it takes, the person who does the physical training, who does the mental stress reduction, the mental health, two people who are doing the hormone care, because we know now it's lifestyle plus hormone replacements, and it has to be in that order. On my paper that I give to my patients, it's in bold with asterisks at the bottom. These two programs have to work in concert together. You can be a smoker and be on HRT, but guess what? You're directly hurting yourself. You've got a pro-inflammatory and an anti-inflammatory. They're gonna cancel each other out, and you're basically wasting your money. Same thing with alcohol, right? Pro-inflammatory versus HRT. So the way to be able to say, I'm gonna be a healthy person, is take control of my life. So I got into a health program, I got on my HRT. So yes, I have to think about how many grams of protein I eat every day. But I look at my body, I've gained more muscle mass, I've lost a lot of my meadow belly, and I'm getting stronger, I'm sleeping better, my hot flashes are gone, I don't pee on myself anymore. Yes, that's what got me to break down, literally, to start hormone therapy. So my life is happier with my husband, all of these things. So it is your choice. I just want you to see that the flip side of if you choose not to do both is that you're at risk of all the things. So it's, in my opinion, it's an on and off switch. Yes, I'm committing this to myself, or I will see the consequences of it if I don't. And it's not too late, it's never too late. My 75-year-old mother-in-law is a much happy camper now because I got her on the vaginal estrogen. I'm talking about all these things, just talk to her new boyfriend. So this is real, and this is at any time in our lives. We can always choose to take control of our health and to not be a statistic. The statistics are what are mind-blowing. So Mandy and I just watched with our precious and supportive husbands. We just watched the pre-screening. You're invited, January 31st. Sign up for it. Come to the Hot Springs
2 to 4
Country Club. We're going to do the screening for the new N Factor 2, which is talking about perimenopause and menopause. It's from all the experts around the globe, and please come. We would love to see you and help educate ourselves more. We were watching the pre-screening last night with our husbands, and they were talking about the dementia risk, you guys. Dementia, who wants to lose our minds, right? Well, 1 in 3 of us are going to. What?
And it was 1 in 5 women at age 45 have
45.
Alzheimer's
45.
already.
Here's the problem. Dementia will show itself in our 60s and 70s, right? Guess when the problem starts happening? In our 40s, late 30s, early 40s. So if we're not protecting our brain, now that we're outliving our ovaries and we need to supply the hormones, the problem physiologically that's happening in our brain tissue is occurring at that time point. So for the 10, 20 years before we even see it is when the pathophysiologic changes are happening. We know this. This is not a question. Yes, maybe it'll be stronger in you versus the next person, but if it's a risk, to use the vernacular. I lost my wallet 5 months ago. I thought I was going to have a massive panic attack. I couldn't find it. I still haven't found it. I had to replace all my cards. I thought I was getting dementia. It was awful. I cried my eyes out. I bawled to my husband. I didn't know what was happening. And I thought, if this is a fraction of what it feels like, if you know you have dementia, I don't want any part of it. I don't want any part of it.
Yeah, the other day I lost my phone, and I'm sure some of you will be able to relate to this, but I couldn't find it. I looked on top of the washer. I looked on the nightstand. I looked where the charger was. I looked in the bathroom. I looked in the closet. I looked in my pocket of my coat. I got in my car to go somewhere. I'm like, well, I'll find it later. I sat on it. Literally in my back pocket. Like,
we're well-educated, high-functioning women.
Yeah. So it's normal. Okay, what is not normal is if you forget you're driving and you forget where you're going. That's not normal. You forget your husband's name. That's not normal. So the big picture things, if you're forgetting those things, that you need to let somebody know. And then we'll refer you to somebody else because that is not my area. But it's okay to lose
How can we
things.
get you on hormones?
It's okay to forget why you walked into a room. It's okay to forget somebody's name that you met 15 years ago that you used to know last year and now you forgot. That's okay. Oh yes, the red lights. Okay, so most women are candidates for estrogen and progesterone and testosterone. The red lights, what I consider that you cannot have estrogen, and I hate to say that to anybody, but unexplained vaginal bleeding, a uterine seroma, right? sarcoma?
Sarc.
Sarcoma. I get those two words mixed up all the time. A blood clot in relation to birth control pills. Okay, and by the way, if you have been pregnant or have ever taken birth control pills and you haven't had a blood clot, those 2 times in your life is when your estrogen level is super, super high. And hormone therapy, like menopausal hormone therapy, is a very small fraction of what your hormone level used to be when you're pregnant. So pregnancy level hormones are like 1,000 or so. And when you're cycling, it's like 400 to 500, okay? And menopausal hormone therapy is like 30 to 50, that's your level. Okay, it's not gonna cause a blood clot. It's not gonna cause you cancer. People are scared of the C word because that's what we were told to be scared of from the media. Not from the doctors who did the study, the media. And that's why there's a 20-year gap in hormone therapy and why doctors have not been trained, because if you're not gonna prescribe it, why would we train doctors, right? That makes sense to me. And so that is why these wellness clinics were born, and pellet therapy and bioidentical compound creams, because people were trying to do something to help women, which is 51% of the population, right? So I understand it, but there is a safer way, and a way that we can prescribe medication that your insurance will pay for, okay? You don't have to pay out of pocket thousands of dollars. You just don't. Even if you don't have insurance, there's ways to get medications that are cheap and affordable for everybody. So don't be scared. You just come and talk to one of us. We can certainly guide you in the right direction.
Absolutely. So if you reflect back on the things that we're talking about, I just invite you to think about what's going on in your life, where you're at, either reproductive or post-reproductive, because we like to say it like that just to stick it to the doctors, because that's how they think of us, right? We're either reproductive or we're over there, right? But we're here to reclaim those over there years, right? Ladies, this is the time when have everybody see the We Do Not Care Club, right? Yeah. This is the time when we're learning that we have a voice. We're learning that we've been around a while. We have wisdom to share. We have those goals and purpose in our minds and in our lives, and we want to share that. And we don't care about the silly little fluffy things that we used to care about when we were younger, right? Because the world looks a lot different when you've been around the block. So this is the time for us to reclaim the sisterhood, reclaim our voices, and know that each one of us has an amazing role, not only in our families, not only in our communities, but in our world. And now is our time, y'all. This post-reproductive phase is actually the time of that rising phoenix. We are here, oh, I got chills, sorry, I'm so sappy. So we are here to help each other. We are here to learn, and we're learning from patients, and patients are learning from us, and this is the sisterhood that we think, that community glue. We always should have been here. We're here to bring it back, right? That's what the HSWLA has been doing now for years, and we're coming to bring in the medical side of it, because I think it just all comes together cohesively and with health. So I invite you to think about what you think your current health span is. I don't mean lifespan. We now know that we can live into our 70s and 80s. What is your health span? How long, doing what you're doing now, would you be able to live with the utmost health, right? Are you lifting weights?
Sarah.
Are you getting enough protein, right? Are you drinking water? Are you walking? Are you doing that everyday pattern of health that's going to lead you towards happiness, peacefulness, and amazing health span? So to kind of think about, what does 2026 look like for you? Is it time for you to say, I'm going to do this, I don't know what it looks like, and it's going to be a lot of hard work initially, then it gets good habits are built into your life, and it's just a part of your life, right? Wearing my vest when I go walk my dogs every day. I don't care how silly I look, we do not care. I do it to help my bones get stronger. My dogs don't care, my husband doesn't care, he doesn't even know what I look like half the time. No, did I just say that out loud? Okay, sorry, back to imagery. So what does 2026 look like, right? Does it look like the new me, bringing in my strength, bringing in my health, and bringing it all full circle to where I can share with my family, and then it's just boom, my friends, and then the environment around me, my neighborhood, blah, blah, blah. You see how the whole thing, we're all gonna get healthy, and we're spreading this amazing story of us. So, can you, yes? Oh,
Thank
the
you.
other Mandy, precious.
Yeah, she likes to talk. It's okay. We love her. Anybody have
COO, CEO.
Anybody have rushing woman syndrome? That like rushing around day to day. Get to this meeting, that meeting, get home, cook dinner, go to the gym, maybe watch TV. Routine at night. Like I don't know. Every day is just like, all right, what 20 things do I have on my calendar today? I mean, it's just, there is no such thing as adrenal fatigue syndrome. Let me just put that out there. Unless you have Addison's disease. Your adrenals are made to pump out cortisol. It might be high, but it's going to do what it's supposed to do. Anyway, I've asked Mandy to
This one.
lead us through a box breathing drill. What's the word? Session, yeah. I'm brain fog, man.
COO.
I can't think of words sometimes.
I'll say yes, ma'am, sometimes. So one of the things that we deal with is that high cortisol, right? That gets us the menno belly because our fat distribution's all wonky until we get our hormones where we need it to be. So stress management is a very difficult thing for us a lot of times in this life area, right, of midlife. So one of the things we talk about, cognitive behavioral therapy, trauma therapy, Qigong, I'm learning about that, that's amazing. Box breathing is so simple and easy. No matter where you work, no matter who you are, you can always just take a couple of minutes to yourself, even if you're sitting here listening to me and you're like, Lord, help me, I'm stressed. We can do a box breathing and kind of get that sympathetic nervous system to quiet down. That's our fight or flight. Encourage the parasympathetic nervous system, that's the rest and digest, to kind of be more activated. That leads us to calm. That leads us to go back to prefrontal cortex, thinking, reasoning, all of that, instead of just our like, whoa, I gotta get this done. So this is a tool I want to leave you with. If you guys don't mind, no one's gonna come and grab your purse or anything like that, I promise. If you'll close your eyes with us for a minute, and let's just find your feet flat on the ground, rest into your chair, find your booty hitting nice and soft on that cushion, and let's just find a restful place. What we're gonna do is just a few breaths where we're gonna do counts to 4. So we're gonna inhale for a count of 4, hold at the top of the inhale for a count of 4, let it out softly at a count of 4, and hold at the bottom of a count of 4. So picture a box. You're creating this box in your mind. Here goes the inhale. Inhale, 1, 2, 3, 4. Hold it nice at the top. 2, 3, 4. Let it out slowly. 2, 3, 4. Hold it at the bottom. 2, 3, 4. Let's do it again. 1, 2, 3, 4. Hold. 2, 3, 4. Out. 2, 3, 4. Hold. 2, 3, 4. 2 more. In. 2, 3, 4. Hold. 2, 3, 4. Out. 2, 3, 4. Hold. 2, 3, 4. Last one. In. 2, 3, 4. Hold. 2, 3, 4. Out. 2, 3, 4. Hold. 2, 3, 4. Just slowly come back to us. You can wiggle your toes, open your eyes when you're ready. Thank y'all for opening your hearts and listening to us. It is so lovely to be here with you. Please let us know what questions you have. Thank you for your attention.
All right, if anybody has questions, we are yours for however long you need us.